Good day. We come together today to talk about a serious concern in the United States, the coronavirus. We have been in contact and engaged with Congress, the Centers for Medicare and Medicaid Services, and the Department of Health and Human Services on where home care fits with the virus. The current state of the novel coronavirus risks in the United States requires that the entire healthcare community evaluate its readiness and action plans to address an emerging pandemic. With over 12 million vulnerable persons of all ages already receiving care in the homes, providers of home care and hospice have effectuated infection control plans and emergency preparedness procedures to prevent and mitigate risks to the patients they serve and to protect and safeguard their caregiving staff. These providers are preparing for a potential upsurge in patients as individuals at high risk of contracting the virus, as well as those who exhibit signs of infection seek care. At present, the CDC is recommending that all elderly remain in their homes in order to reduce the risk of exposure to the virus. Further, a primary course of action for individuals demonstrating symptoms of the potential coronavirus infection is self-isolation in their homes. The home care community is stepping up to meet the challenges presented by this virus. To meet these emerging needs, it is essential that several steps be taken to ensure timely access to care. These steps include, first, the ready availability of proper safety equipment for caregiving staff. This includes proper masks, clothing, and gloves. Second, early availability of virus tests for individuals demonstrating high risk of the virus. This ensures that home care resources are employed prudently and efficiently. Third, full deployment of the channels of real-time updates in infection incidence data and care protocols. Fourth, seamless communication channels between other healthcare sectors and the home care community. High-risk patients should be directed to care in the home as soon as possible, rather than presenting risks of transmitting the virus to others while in an emergency department, inpatient hospital, or physician waiting room. And finally, health benefit programs including Medicare and Medicaid, along with the VA and other private insurance plans, in addition to managed care plans, must institute temporary modifications to coverage standards to address the need for care in the home. These changes would include the elimination of restrictions on the use of telehealth services, homebound requirements, the waiver of Medicare conditions of participation, and any patient cost-sharing obligations. The National Association for Home Care and Hospice, along with 11,500 home health agencies, 4,900 hospices, and more than 20,000 other home care providers stand ready to be part of the healthcare collaborative in addressing the coronavirus COVID-19. We call on Congress, Centers for Medicare and Medicaid Services, the U.S. Department of Health and Human Services, and state health departments to work in partnership with the home care community to deal with this crisis. Thank you.